Hello, everybody. My name is Charles Shepherd. I'm a retired consultant pediatrician in Craigavon Hospital in Northern Ireland, where I worked for many years. Since 1987, I've had a big interest in tuberous sclerosis, and this resulted in me doing some research into tuberous sclerosis. I worked for a year with Dr. Manny Gomez in the Mayo Clinic, looking at all his cases of tuberous sclerosis. And this culminated in me presenting my MD thesis to Queen's University in 1995 on tuberous sclerosis. After that, I founded the Northern Ireland Tuberous Sclerosis Clinic with Professor Patrick Morrison and laterally Dr. Deirdre Donnelly, who has joined to help, and Rachel Hardy, who's a clinical nurse specialist geneticist. And up until recently, I participated fully in the clinic. I have now stopped work in the clinic. So for this talk, I'm going to talk about tuberous sclerosis complex, and I'm entitled it Living with TSC. So I want to take you back maybe to the first sentence that seems to be very popular in all the scientific publications in tuberous sclerosis. And I often think, if some of the parents have had their child diagnosed with tuberous sclerosis, and they see this sentence, it really does sort of complicate matters for them. So I thought maybe just firstly, we would take this sentence and try and explain it, exactly what it means. Tuberous sclerosis complex is a multi-system genetic disease. It is inherited as autosomal dominant. The main organs affected are the brain, the kidneys, and the skin, but lesions have been described in other organs such as the heart and the lungs. So what does it mean? Well, genetic, it means it can be inherited or passed on to the next generation. And it's inherited, as you know, by autosomal dominant type inheritance. What is an autosome? Autosomes really are chromosomes, and chromosomes are really classified as bunches of genetic material or genes other than the sex chromosomes. The sex chromosomes and the autosomes make up the chromosomes. So chromosomes come in pairs, and generally speaking, when the baby is born, one chromosome of the 46 comes from each parent. And then in some genes, there's some chromosomes, the gene can be defective. And in tuberous sclerosis, a gene on one of these chromosomes is defective. And this is either the gene found on chromosome 9 or chromosome 16. So inheritance, what does it mean, the inheritance? Well, it means it's autosomal dominant. So it means that only one gene of the pair seen in the parent needs to be defective for the gene to be passed on. All people who have the gene are affected with tuberous sclerosis in different ways. Children of a person with tuberous sclerosis, if they're able to have children, have a 1 in 2 chance of being affected. And the big thing here is people with tuberous sclerosis complex can be affected by different degrees of severity, from having minimal symptoms to being severely affected with epilepsy and severe learning difficulties. And this is one of the important things to grasp in tuberous sclerosis, that there can be many different severities. I mean, indeed, there's a small proportion of people who don't know they have tuberous sclerosis until they have a baby who has been found to have tuberous sclerosis. So one of the interesting things about it is really the different types of tuberous sclerosis, and we call that phenotypes. The word used as phenotypes is the different phenotypes of tuberous sclerosis that we see. And this happens in all the populations with tuberous sclerosis. So when we come to consider living with tuberous sclerosis, well, let's have a look and see, what do parents live with? What do patients and parents live with? Well, one is the burden of genetic disease. So you don't know, have you passed this tuberous sclerosis onto your child? Did it arise freshly in your child who was diagnosed with the condition? If you have more children, does it mean that they have a chance of having tuberous sclerosis as well? And there is a big burden of genetic disease. And what are the requirements in tuberous sclerosis? One, it is that the signs and symptoms are quickly recognized and that it's quickly diagnosed. And this is happening more and more now. All people, patients, parents, and children with tuberous sclerosis have an expert genetic opinion. It has been found through a lot of clever work done by a lot of geneticists, both in the UK and in the United States, that the defective gene is located on chromosome 9 or 16 to confirm the diagnosis. Parents are screened for this if they produce a child with tuberous sclerosis, and then they're entitled to expert genetic counselling. And I think the expert genetic counselling is fundamental to you being able to live with this and know the risks of it. One of the great things that we have now, and it really depends on what people feel about it, but I think it should be offered to patients with tuberous sclerosis, that if they do have tuberous sclerosis, that they have the opportunity for selective fertilization. In the Northern Ireland clinic, we have a young girl who was diagnosed at the age of 12 with tuberous sclerosis. She went to the skin clinic and she had a lot of these hypopigmented macules that are found to have tuberous sclerosis. And she had a lot of difficulties with angiomyolipomas of her kidneys, and she had lung disease. But then she got married and she had a baby with no really offer of selective fertilization for it. But thank goodness that the baby wasn't found not to have tuberous sclerosis. But for her second child, she is actively considering selective fertilization. So I think people have all these options for it to try and prevent them having another child with tuberous sclerosis. Tuberous sclerosis involves multi-system disease. In other words, it can affect different systems. And the big ones it affects are the skin, and you can see it with the different types of skin rash, the angiofibromata of the face, the depigmented macules that are seen, the growths in the nails, especially the toenails. It affects the brain by producing a lot of what's tubers in the brain that can cause epilepsy and can cause mental handicap, severe intellectual disability. And it also, in about 45–46% of patients with tuberous sclerosis, it can affect the kidneys by giving that large angiomyolipomas of the kidneys, which can cause bleeding, and if left untreated and they're growing, can result in renal failure. So it does need to be monitored very well and very easily. In the brain, as I say, tumors in the brain can cause epilepsy and learning difficulties. The other thing it can cause in the brain is our brain is like it's got a hole in the center, and these are called ventricles. And in these ventricles, there's big calcified lesions grow in tuberous sclerosis. And in a certain percent of patients, about 7 or 8%, these can grow and cause a brain tumor. And this brain tumor is caused a subependymal giant cell astrocytoma. And it is a very slow growing brain tumor, and it's unique to tuberous sclerosis complex. And this is one of the things that you also have to live with. And one of the things that you can screen for, although the arguments against doing routine screening for it, or just scanning the child if the child shows any symptoms like headache or drowsiness of the tumor, and getting the tumor detected early so the child can be referred on to the neurosurgical department. So really, what parents and patients live with in tuberous sclerosis is the epilepsy, the different grades of learning difficulties, the various behavioral problems that we see in tuberous sclerosis, partially as a result of learning difficulties. And this is one of the things that perhaps we do understand less, is all about the behavioral problems, and also the fear that your child could develop a brain tumor. So what do you do, and what do we do? Well, epilepsy needs an accurate diagnosis to make sure that you do have epilepsy, genuine epilepsy, although as 90% of patients with tuberous sclerosis have epilepsy, the diagnosis is probably less in doubt than it would be in the normal population. a prompt diagnosis and investigations to be done, medication if it is started with minimal side effects, the medication is explained, the medication is monitored properly, and that the patient has good compliance with the medication. And this involves the doctor making sure that the child is on the proper preparation. In other words, that they get a preparation of the drug that they can take. If they can't take tablets, that they're given maybe liquid, or they're given granules, or given all the various preparations which are available depending on the drug. And also that the triggers for the epilepsy are identified, and that you get good advice about the activities and what to do and what not to do. I know one of the things that I had to do when I was monitoring children with epilepsy was to say to them that they can't drive, because a lot of them are driving their wee tractors around the farm, and it had to be stopped, especially the slightly older children. And they used to get very resentful for me when I was said that they couldn't drive. There was one wee lad had an old car that he used to drive around the field, and when I said, look, you cannot drive with it, you've got to be careful, he wasn't at all happy. What do you need when living with learning difficulties? Well, you need to have your needs identified. Your needs need to be provided, and the different types of education that you need. If you have autism or autistic type tendencies, that you get proper educational strategies to be able to deal with this. Again, with the behavioral problems that occur in tuberous sclerosis, again, that you have access to the proper services, and that they're seen, and that the behaviors are analyzed, and there is a proper management. Very often it's not drugs that make for proper management. It's good conditions, good proper conditions for the child to be able to function in. Kidney disease in tuberous sclerosis, well, these are the forms of angiomyolipomas, benign tumors of the fat and muscle. And the angiomyolipomas can, as I said to you earlier, can cause bleeding, or can compress the kidney if unchecked, and cause renal failure. A small proportion of children with tuberous sclerosis can get renal cysts, and this can result in renal failure as well. So what are the requirements? Well, you need renal scans at the diagnosed to identify kidney disease, and regular scans to identify if they have kidney disease, and to see if they have an angiomyolipoma, to see if it is growing and what is happening to it. And this is one of the things that I believe that needs to be done better, certainly in our practice, was that all we were getting is just sort of reports saying, well, I think the tumor is still the same size, but there was no proper way to measurement. And one of the things I've been asking the Tuberous Sclerosis Association in London to do is to see if we can get a fixed protocol of how to report renal scans. In the skin, you have various lesions, angiofibroma, which are, as I said, are the sort of ugly fibromata that are on the face that are very much pathognomonic of tuberous sclerosis. The depigmented macule, the flat forehead plaque, your periungual fibroma. And what are the requirements? Well, I think all these children should be referred to a dermatologist. If available, they should be having laser. If available, they should have laser treatment. And laser treatment is okay, but it's just not a good thing, the best thing to be dealing with it. What is happening now is that everolimus cream is coming in, and it has been used much more. And certainly in the clinic in Belfast, we'll be able to put a lot more patients onto everolimus cream, and the results of this are very good. One of the things I believe in helping you live with tuberous sclerosis is good parent power. And I very much take the example of the Tuberous Sclerosis Association. And I think that the people that we need to thank are very much Janet and David Metcalf, who were the parents that started, Anne and Tom Carter, Graham and Graham Harker and Anne Hunt, Sadly, some of those folk are no longer with us, but they demonstrated really what good parent power can do and how it can be really a force for good. And the parents need to be very assertive. And from good parent power should come a specialist tuberous sclerosis clinic, like the ones that are set up in various places now through the United Kingdom and which we have in Northern Ireland. And our role very much in a specialist clinic is not to be all the answers to everybody, but is to refer patients if necessary for specialist opinion, but also just to try and coordinate their care and make sure that all their needs are done. And also it's very important that in the special tuberous sclerosis clinic that we do listen to parents. So the positive points that we've had now since I started with tuberous sclerosis in 1987 that have happened in the intervening year is, I think first of all, is the advent of everolimus, which is a very good drug. It's called an mTOR inhibitor, but it actually acts on the pathway of causing tuberous sclerosis and has been found to be very good in the treatment of children with angiomyolipomas, and it can be used in the subependymal giant cell astrocytoma if it is not amenable to surgery. There seems to be a much better range of anti-epileptic drugs used at the minute, less side effects and better effect on epilepsy. One of the drugs that we're still waiting to see evaluated is the effect of cannabis oil, and it is slowly being introduced into the United Kingdom. There's much better diagnosis of tuberous sclerosis now, especially now that we have the gene identified on chromosomes 9 and 16, and you can actually isolate the gene. But there's some people with clinical tuberous sclerosis in which the gene can't be identified, and you still have to go and look at the symptoms. One of the things now, and this applies to all rare conditions, is that there's much better information on the web, and that doctors, GPs, and hospital doctors who don't know much about tuberous sclerosis, if they are confronted with a patient with tuberous sclerosis, can actually get good information on the web. One of my roles at the minute is tutor for the Royal College of Physicians here in Dublin for their diploma in paediatrics course. And one of the good things that we teach, and which we're seeing happen, is that we're saying to young doctors in general practice, say that if you have a child with a rare condition like tuberous sclerosis, you do need to get onto the web to find out all the aspects of that condition that you need to be worried about. Much better scanners, much better CT scanners. The MRI scan has been introduced as well, and it has been a revelation. And of course, as I said, better diagnosis is because of identification of the gene. So just to sum up, tuberous sclerosis complex is a complicated disease. It's not very common, but living with it, you do have certain burdens to live with. One is the burden of living with genetic disease. Two, the possible burden of living with kidney disease. And three, the burden of living with the disease affecting the brain and causing epilepsy, causing learning difficulties, causing behavioral problems, and possibly it can lead to a brain tumor. But it is possible to improve the quality of life of people with tuberous sclerosis and helping them to live with it by good education about the condition, being aware of what's likely to happen, and the better and the advances in medical technology that have happened over the last number of years. Anyway, I look forward to meeting you all in Dublin, and thank you very much indeed now. Bye-bye.